Dhanyavad Priyaji for the introduction. I hope you can see my slides clearly. So for this next part, I'm going to follow on from Dipanji's earlier introduction about the Hindu Medical Association to now speaking about future directions for the organization. So referring back to the model that Dipanji used, let's just spend a few minutes considering what. That is to say, what will the Hindu Medical Association's key functions be? So the core function of the organization at this point is to create network amongst Hindu health professionals, regardless of country of origin. And this is important because it's only with the development of network that the Hindu Medical Association can carry out its functions. And indeed, the hope is that the network itself will drive future development in establishing the need amongst Hindu healthcare professionals and highlighting our rich contribution to UK healthcare. But in addition to this, the association intends to hold events, so hopefully twice yearly. First of all, a summer event, usually, hopefully around International Yoga Day, such as this one, and an autumn-winter event around Diwali or Dhanvantri Divas. This will allow members to enable networking and learning amongst them. And just as we have had the privilege to hear this very illuminating talk today from Professor Basu Roy, we would hope to host speakers at our future events. We would also hope that in time, the networks that we develop may foster secondary opportunities, for example, the coaching and mentoring. Another core function is for the association to represent the UK Hindu healthcare professional voice. And we would wish to raise awareness of issues that affect the Hindu healthcare community. So liaison will be a key function going forward. We would wish that Hindu Medical Association will link with other UK Hindu organizations, such as student organizations and community organizations. We would want to link with national and international institutions for opportunities to provide education and training for the community, for healthcare professionals and for students. And we would wish to liaise with NHS organisations and with the UK government on matters facing and relating to Hindu healthcare workers and to Hindu patients. So moving on, the Hindu Medical Association aims to tap into dharmic insight. Well, what do we mean by this? Well, we would wish the association to highlight the eternal relevance of dharmic principles by applying them to UK healthcare settings. And we hope that HMA can popularise dharma-based activities such as yoga and dhyan in order to contribute to the well-being of NHS staff. We intend that the Hindu Medical Association promotes the dharmic viewpoint. So this is a viewpoint including principles such as equality, sustainability, and reducing harm, in order that this dharmic viewpoint can contribute to and improve healthcare systems in ways such as low carbon catering, renewable powered transport, sustainable procurement, and waste reduction. And we would wish the association to provide a forum for the Hindu view on physical and mental health matters, such as the health benefits of yoga, Ayurveda, meditation, holistic health, and also a forum for espousing the Hindu viewpoint on issues such as birth and death, and the application of Hindu ethical principles to issues such as organ and blood donation, euthanasia, abortion, cloning, gender therapy, and vaccination. And further to this, what about the Hindu Medical Association's relationship with people within the UK Hindu community? Well, we would wish the association to provide education about health issues that affect the Hindu community, such as fasting, vegan, vegetarian diet, vitamin D deficiency, as well as disease presentation and symptoms. And we plan to connect with local communities on healthcare matters such as secondary prevention, heart disease, screening regarding diabetes and cancer awareness. And we hope that the HMA can facilitate community engagement with public health measures such as vaccinations and basic life support. And finally, what does the Hindu Medical Association have to offer areas such as seva and research? Well, the association wishes to promote voluntary and charitable work both in the UK and overseas. And we hope to promote research into Hindu systems, that may benefit health, Hindu medical history, for example, and Hindu medical ethics. And we would hope that this would build a bridge collaboratively between modern medicine's strengths, just as Professor Basu Ray has beautifully expounded, between modern medicine's strengths and the ancient wisdom within Hindu systems of Ayurveda, with its vast, well-documented plant-based pharmacological therapy contributing to health promotion and disease prevention, Hatha Yoga for physical health, and Dhyana for psychological health. So that concludes the what in terms of the core functions of the association. But where is HMA based? Well, our website, www.hindumedicalassociation.org.uk, is under initial stages of construction, but it's the best place to find further information as things develop. And discussion is ongoing at the moment about use of other social media platforms. So at the website, if you go to the Get Involved tab, here you can see it on the right hand of the screen. It's the right hand most on the tab list on the screen. We'd be really grateful if you can leave your contact details here and any message. This is definitely the most efficient way for us to build up a database of UK Hindu healthcare professionals who would wish to be part of this organisation. And we plan to keep updating the website in order to keep members up to date. Alternatively, you can email the association at the address shown here, so info@hindumedicalassociation.org.uk. We would love to hear from you. We plan on sending out a quick few-minute-long survey to participants soon that will help us prioritise or strategise for the future. And it would also be good to find out where and in what capacity people work, so that we can better understand how appropriate networks can be formed, both from a geographical perspective for face-to-face meeting accessibility, and from the point of view of grouping of roles such as students, hospital or community-based practitioners, or specialty groups. And we know of many people who wanted to but couldn't attend today's meeting. So please do spread the word about the Hindu Medical Association amongst your networks and encourage your colleagues to join us. And finally, we need you. We need Hindu health professionals to come forwards to be part of this association and to contribute to it. So please, this organisation is for all of us. It's to help all of us contribute to the wider society. So come forward and join in. Namaste.